So hello all, this is Dr. Pavan Yadav here. With me today I have Dr. Srivatsa. He is a consultant pulmonologist at Aster CMI Hospital here at Bangalore. So Dr. Srivatsa has completed, after completing his post-graduation, he has been extensively trained at Singapore, Japan and Malaysia as well. So he is an accomplished clinician, pulmonologist, researcher and a very good friend of mine. So we are privileged to have him with us today. So today, as we go on dissecting the ongoing pandemic of COVID-19, so many topics and many questions comes our way. And one of the very important such topic would be to understand the concept of what is called as herd immunity. A lot of questions and a lot of discussion is going on about the role of the natural immunity as well as vaccination in developing herd immunity amongst the population so that the spread of the virus would be slowed down or eventually come to an end. To this end, to understand this concept, today we have with us Dr. Srivatsa, and let's go and have a discussion with him and understand this topic in greater detail. Over to you, Srivatsa.
Thank you, Pavan. Thank you for this very kind introduction. And I'm so happy to be here today discussing these points. And I think you're the right person to guide through this present discussion. So what we are looking at is basically to understand what are the concepts revolving around the further care of COVID-19 from a public health perspective, rather than treating individual patients, because on the long run we need to look at various ways of halting the progression of the disease, and there are very few concepts that have been proposed by experts, and how to understand these concepts and what implications it is going to have in our daily life, taking this forward over the next year or so, is what we're trying to discuss in this particular discussion. So coming to the first initial point, Pavan asked me, what is herd immunity?
Yeah.
So basically what we're trying to understand here is the epidemiological basis of this concept of herd immunity. So when you say herd immunity in simple terms would mean that when a large part of the population is infected by the virus, not necessarily every person in the population, when a large proportion of the population is affected, it indirectly confers immunity to people who have never contracted the virus. So this is an advantage of herd immunity.
Okay.
And how does this herd immunity, be of benefit in certain types of diseases? Not necessarily in this case with COVID-19. In other, diseases, definitely it has proven to be of benefit. And how are we going to, project this concept in a purview of COVID-19 is what we're going to discuss. So any infective disease has this, infective number called basic reproductive number. So this is basically the average number of secondary cases that an infectious disease generates when one infected subject is let into a population where other people are not infected. And this is in normal circumstances, excluding lockdown and other things. So it was seen with earlier examples. Let me take an example. The 1918 Spanish flu, it was seen that about 1/3 of the entire population was infected and about 50 million casualties were there. And the basic reproductive number in this case was about only 1.8. Whereas unfortunately with the SARS-CoV-2, which is the etiological agent for this particular pandemic, COVID-19, the basic reproductive number is 2 to 3. This is quite large. And many experts say that this might be even an undercalculation of the basic reproductive number, because SARS-CoV-2 has a very unique feature of having a large number of asymptomatic carriers, right?
So now, if I can come here, so what you're trying to tell is one person who is infected with COVID-19 can actually infect up to 2 to 3 people who are vulnerable to acquiring this infection.
Exactly. Right. So that's what the basic reproductive number indicates.
Yeah.
So if there's one person, he's going to infect another 2 to 3 people around him. Without any kind of barrier measures like this lockdown phase or anything, where the person is free in the community, and he goes around coughing without wearing a mask. This is the normal infective rate that will happen.
Okay, sure.
Right? So now, how are we going to understand what is the basic reproductive number and how it is going to affect herd immunity? First, we have to understand what is the asymptomatic carrier rate and how it affects the basic reproductive number in case of the COVID-19 infection. So, to calculate the asymptomatic rate in a population, it takes a large amount of logistics, large amount of, spending, as well as involve a very large sample to understand what is the asymptomatic carrier rate. Now, unfortunately, we are not in the midst of circumstances to conduct, any kind of, observational trials to understand what is the asymptomatic carrier rate of the population. And since this disease has spanned the entire world, involving almost most of the countries, the asymptomatic rate might even vary from country to country based on the country's, genetic pool, the immunity against that particular infection. So we might not be justified to project one number across the entire, world, but definitely we have some data that's trickling in to suggest what is the possible amount of asymptomatic rate. So this study as such, which I'm presently showing you, was conducted in Japan, where a flight carrying Japanese citizens from another country lands in Japan, and basically what they do at the airport is triage them as symptomatic as well as asymptomatic patients. And these symptomatic and asymptomatic patients then are subjected to routine RT-PCR. This is the normal way of detecting the virus as of present, and then you will classify them further as positive and negative patients. So the people who are asymptomatic is what we are concentrating on, and even though the sensitivity of this present test is projected to be somewhere around 70% with the RT-PCR, about 4 members of the asymptomatic group were found to be positive. Now, using a special equation called the Mayer's equation, we calculate the asymptomatic rate to be about 30.8% with a 95% confidence interval, which is quite good. And all these 4 patients were followed up over the next 30 days to see if they develop any symptoms or not. And none of them developed symptoms. This is having a significant implication in public health perspective, because you have so many patients without any symptoms roaming around freely in the community. So imagine 30% of the population is still free at large in the community, who have not been tested, who are going to spread the disease to those who are vulnerable in the population. And definitely when we are considering something like herd immunity, these patients or these people in the community who are not tested must be factored in. And 30.8% is quite significant for any kind of infectious disease which is going amiss. Now, let's move back to the old concept. What is herd immunity?
Yeah.
So, like I already said, herd immunity is the immunity which the population gives you indirectly, even though you are not immune to it. So, how do you calculate this? There's this Y over here, which is the minimum percentage of the population that has to be affected. And R0 is your number, which we are already calculated to be around 2 to 3. So imagining I take 3 as the maximum number, then you would require almost 66% of the entire population, roughly 67% of the entire population that has to be infected to confer herd immunity. So, that's quite a large number. I think that has to be infected before, we acquire herd immunity to the entire population and the disease stops spreading. And once you've acquired herd immunity, you don't need to go into lockdowns and other things, which has, obvious consequences on both social as well as economic parameters in any kind of population.
Okay. So Dr. Srivatsa, what essentially you're trying to tell us is that as long as 67% of the population has developed immunity for this particular infection, so we will continue to be implementing these measures of social distancing, etc. So to make sure that the spread of the virus is not rampant and the amount of people who are becoming critically sick and getting admitted in the hospital will be reduced. That's one point. Second is to develop this herd immunity, So what are all the possibilities? Like how does this herd immunity develops, and like how much time would it take for 67% of the population to get infected and develop this herd immunity? So can
Correct.
you enlighten us about the implementation of the vaccination process here, because vaccination has been successfully used previously in other infectious diseases to develop the herd immunity, so that we have successfully defeated many of these infections in the past. So what do you think will be the role of vaccination in this current pandemic?
Correct. So there's definitely a role for vaccination in this present scenario. But how effective are these vaccines going to be, considering the virus having many different strains, as well as mutating at such a large means mutating so quickly into so many different serotypes for such a short period of time is of concern. And definitely, we have seen that vaccines against these RNA virus have proved to be, time and again failed many a times in the past. But definitely, I will not be pessimistic in this note, because there have been RNA virus which we have defeated, like Dr. Pavan is suggesting. One such virus is the polio virus, which belongs to the picornavirus group, unlike being belonging to the coronavirus group. And it took quite a long time to achieve or even come to this vaccine which could defeat the polio virus. So similarly, we are looking at developing a similar, vaccine against the coronavirus. And the coronavirus again is being trying to make us run behind it, because it's not quite easy. There are various experts in this field who are telling that roughly we might be going into somewhere around 18 months to 2 years to find a proper solution to achieve a good vaccine against this virus. So let me briefly go into what the effect of herd immunity is, the first part of your question. So if at all I let this natural infection spread in the community as such, we are looking at a population of 1.3 billion in our country as of today, and a case fatality rate of about 3.5%. Okay, so you would roughly require about 87 million people needed to be infected by the virus, but the collateral damage is going to be significant. This is about 30 lakh people who will be losing their lives. And since every life matters to us, even from public health perspective, every person, individual is important, and losing lives cannot be the solution to let the rest of the population develop immunity. So what is the best way to take this herd immunity concept forward? The only solution is vaccination. And we need to have a vaccine soon enough, a vaccine good enough to stop this virus from spreading in the community. Another important factor that might be a downside for this possible concept of herd immunity is because there is a probability of reinfection. So we have seen already numerous papers from Japan coming in. We have seen numerous papers from South Korea coming in that say that there is a chance that reinfection can happen to the tune of 14%, which is quite large again. And why this reinfection might be happening? Probably, possibly because of different serotypes of the virus. So is a vaccine against one serotype of virus going to confer immunity to other serotypes? Also is another question that has to be answered and is quite unanswered. Now, with respect to your next question, which is vaccine, is it the only hope we have? Yes, this is possibly the only hope we have as of now. And as of now, from whatever data I have, the genomic sequence of this virus was published on 11th January. So basically, there was a coalition for epidemic preparedness innovations that was formed, so that there are various platforms for this vaccine development that has been shared with most authorities throughout the world for speed tracking the vaccine development process, so that we are coming with newer vaccines as soon as possible, and these vaccines are available to the rest of the population as soon as possible. And the first COVID-19 vaccine was launched on 16th March 2020 at Washington, and this is basically an mRNA vaccine which has been fixed into an adenovirus vector, and that has been used as a that has already entered a clinical trial, and hopefully we should hear from them by the end of this year. And if all goes well, as per Dr. Fauci, who is their head of National Infectious Diseases and Allergy, he says that if everything goes well, we should have a positive result by, say, January or February, right? And then there is another group which is also very confident. That's the Oxford group from UK, and they have again trying the adenovirus as a vector to incorporate certain proteins of the virus into it. And then they have also started live testing of the vaccine, and hopefully we should hear from them in another year or so. And large scale production, we are being so optimistic that large scale production of the vaccine is also already started in many parts of the world, including in India. The Serum Institute has already started stocking up these production of these vaccines, be it effective or not effective. They say that we should be able to have batches enough to vaccinate almost the entire world ready. As of course, we are going to give the vaccine to the most susceptible part of the population first, and then dissipate it up among the rest of the population, like we did for smallpox or any other infective diseases. So, to our surprise, within a short span of time, within 5 to 6 months, we have 15 candidate vaccines, and only 78 are mostly viable. And these are the most vaccines that have entered the clinical trial as of now. So we have to understand the virus as such. There are various proteins. We are going to concentrate on this one protein called as the spike protein, that is the S protein. And if you see, this virus doesn't even resemble its earlier, cousin, Pavan. Like SARS-CoV is its earlier cousin. It hardly resembles it to the tune of 75%. 93% of this virus proteins resemble a bat virus. A bat virus. So more or less inching towards the theory that this virus was developed from a bat as a source. And I think this was definitely, I propose that this could have arisen in one of those wet markets in Wuhan, more like rather than anywhere else, from a lab or anything else. So the challenges thrown with vaccine development already are that the S protein, which is there in these vaccines, most of these already proposed vaccines have this S protein. And it is seen in that earlier vaccine developments for MERS as well as SARS that the antibody dependent enhancement is a big issue. I think, Pawan, we have all heard about this antibody dependent enhancement, and we keep talking about this dengue thing. We are infected with one serotype of dengue, then we are infected with another serotype of dengue, and then unfortunately we develop a significant inflammatory mediated collateral damage in the body. In fact, you would assume that the patient should get better because he's already exposed to one virus of dengue, he'll have immunity against another virus. But it proves otherwise, and the patient lands up with serious immune-mediated damage to the body, which can even take him to the ICU. And this is one such concern we have with this S protein. However, there have been proposals that instead of concentrating on the entire S protein, we should look at this S region of the RBD region that is, less immunogenic and might not lead to so much of immune-mediated damage in the body. The other factor what they're looking at is adjuvant. Like we all know that this is going to be an inactivated virus. So we're looking at something like an adjuvant that they will add so that the immunity is boosted. And adjuvants have been there in many virus vaccines, as we know earlier. And we need to look at preferably a TH1, because they've seen that apart from antibody dependent killing, which is important in most viral pathogenicity, we also need some amount of cell mediated immunity against these viruses. So TH1 type of adjuvants are essential to drive this kind of immunity for better protection. And we are also not sure how long these present vaccines confer immunity. We already know our influenza virus vaccines confer immunity only for a year. Even though seasonal flu kills so many, lakhs and lakhs of people all over the world, especially during the winter season, we still see that, these vaccines have to be given every year. So is this some kind of a cycle we will be going into with respect to COVID-19? Are we going to be vaccinating patients again and again throughout the year? And will we be able to even achieve, annual vaccination of the entire population on a yearly basis? Again, is a difficult question to answer.
Okay.
And so the other thing is delivery of the material to the cells. There have been other proposed delivery mechanism where they're looking at nanoparticle based delivery systems. Instead of the actual virus going in or using any other virus vector like the adenovirus, certain pharmaceutical industries are looking at using nanoparticles, biotechnologically engineered particles that have the virus proteins, but it is not the virus themselves.
Okay, sure. So, so now we have the dilemma of whether to save lives or to save livelihood, right?
Correct.
Yeah. Now we can't be continuing the lockdown forever, so it is being released in a phased manner. So now the question is, there have been this concept of immunity pass or immunity passport. So until the vaccination is available, so people who have been naturally infected and had developed the immunity against this COVID-19 infection, so whether they are safe to go out and start functioning in the population without the risk of contracting the virus. So can they be the people who can pull the economy back and make the economy stand on its feet again? So what are your thoughts about this concept of herd immunity and the immunity pass and immunity passport which is being proposed?
So basically, this is a concept that once you develop immunity towards a particular virus, you're assumed. There's an hypothesis here which you are working on. You're assumed to be immune to that virus for the rest of your lifetime. And whether this concept is actually true is not yet known. There is no papers or evidences as of date, till at least this month, which is published, which suggests that the immunity against coronavirus is a long-term immunity. And sometimes even the extent of reinfection, 14%, proves otherwise, that it might not be long-term and there might be a waning kind of immunity towards this kind of virus. So with the immunity passport being mooted as a suitable solution for large scale masses to return to work at certain types of industry, say the various corporate offices are looking at screening people who are coming back to work either with an antibody test, basically to understand whether they have developed immunity to these kind of infections.
Yes.
But WHO stands clear. They say that they advise against the use of this. And in many other health bodies in the world are also suggesting that this immune passport, which has caught up and is causing a lot of hue and cry in UK, Germany, and other countries, that it might be too early. I would not say that it is not the right way to go ahead, because it is too early to even judge this point. So I would say that it is, a possible hypothesis that can go wrong from what is actually happening. From my viewpoint, I don't think immune passports would stay long enough, and immune passports are not the right way ahead, because then you're looking at a lot of other societal changes in the community and differentiation among the people in the community, that you are immune, so you're actually basically giving people who are immune to the virus more benefits than the people who is not immune to the virus, without him being freely accessible to a vaccine. So I think that is quite unfair in the societal aspects, as well as you're pushing that person into going and getting an infection himself because he has to come to work or whatever. So I don't think that will hold good, and immunity passports must be stricken off the list as of now, until we have enough evidence to say that a person who is infected has long-term immunity for this disease. And I don't think that the way things are turning around, it is going to go that way.
Okay.
Yeah. And most of these laboratory tests that have been coming out for antibodies, they have not yet been validated. Yes. Though they might have increased sensitivity, specificity, as we already know. We have a whole bunch of antibody tests that are already there. Yes. And many government organizations are already moving to, getting, vaccine, antibody testing to a large crowd, especially those who are susceptible, like healthcare workers and all that. So I don't think this is a long-term option at this present scenario.
Okay. So this is an evolving pandemic yet. So we have probably more questions than answers at this point in time. But we should continue to dissect and keep getting clarity and make our concepts clear, so that we will be able to fine tune and give a direction to our efforts in defeating this pandemic. So Srivatsa, it's been a pleasure. Thank you so much for giving us your valuable inputs and making things very clear and simple for us. So any final words before we conclude?
Fantastic, Pawan. I think I must really thank you for going about doing this, because this really helps to put across certain informations that might be boxed and not easily accessible to a lot of people. Basically, so that means now we are flooded with a lot of information. Which information is right? Which information is wrong? Nobody, even people like us, don't have a clue, because there's so many biased reporting of things which is happening everywhere. So what we intend to do through these discussions, thank you for showing light, is basically bring out the proven concepts and to focus on what is the right way of going ahead from public health perspective about managing this ravaging disease. Thank you so much for doing this.
Thank you, Vatsa. Thank you so much for your time. We'll stop there. Thank you.